This conference will now be recorded.
Good morning, everybody. Previous class, I dealt around 20 X-rays. Now, remaining X-rays I will discuss. These X-rays are very important for your orals. So, all of you concentrate and try to interact with me. If you have any doubts, you can stop at any level and you can clarify your doubts. Okay? We all X-rays are over. I think 23rd onwards. Any doubts are there? Previous X-rays? If anybody is having any doubts, you can ask me. So just these all are over in the previous class, so I'm skipping these X-rays. So from today, from this X-rays, okay. So can anybody read roll number 32? Present or absent? Just read the X-ray. Read the X-ray means we have to describe the X-ray. What is this X-ray? Which part it is? Which view? Skin and soft tissues, bony rib cage, then lung parenchyma and cardiac borders, diaphragmatic borders. All you have to describe. Roll number 32. Present or absent? (33), 34. Roll number 34. 35. 37. 40. Roll number 40 absent.
Ma'am.
Roll number 40. Pavan, neede kada?
Yes, ma'am.
Just read the X-ray.
Plain X-ray. Plain
Okay.
X-ray of posterior anterior view.
Plain X-ray of chest.
PA.
PA view. Plain X-ray of chest. PA view. Okay.
PA view. Skin and soft tissues are normal. Costophrenic angles are visible, normal.
Cardiophrenic
Right
angles?
and left cardiophrenic angles are normal. Right and left borders of heart are visible. Haziness present at the right middle lobe of the
Is it non-homogeneous or homogeneous haziness? Opacity.
non-homogeneous, ma'am.
Okay, good. Non-homogeneous opacity in the right. Which zones? Upper, middle, lower zones?
Middle and some part of lower lobe.
Okay, good. So most probably
maybe hilar lymph node. Hilar lymph
nodes. Hilar lymph nodes usually uniform. What
abscess,
you are telling?
Abscess, any lung abscess.
Lung abscess. Why you think it's a lung abscess?
In center there is a black color.
And there are thick. This is thick walled cavity. Thick walled cavity actually with opacity underlying. It's not clear cavity also. So most probably lung abscess because thick wall. You can see this is the wall. Okay. Thin walled cavity means it may be due to tuberculosis, cavitative lesion, but thick wall with non-homogeneous opacity, most probably lung abscess. What are the commonest causes for lung abscess organisms? Pavan.
Hydrated disease, ma'am.
What? Commonest organisms I asked. Klebsiella pseudomonas. Okay. Okay, right side lung abscess. Roll number 50. Who is roll number 50? 50. Absent. 55. Roll number 55. 57. 60. Roll number 60.
Yes, ma'am.
Anybody voluntarily? Any one of you can answer, can read this X-ray. Try to read. If any mistakes are there, I will correct.
It's a X-ray of chest
I want
and
to know the name and roll number.
Priyanka, ma'am.
Okay, roll number?
58, ma'am.
Okay, good. Just read the X-ray.
It's a X-ray of chest and upper part of abdomen. Plain X-ray.
Plain X-ray of chest and upper part of the abdomen. Good.
PA view of chest and abdomen.
PA view.
And
In the exam also you have to read like this only. Don't tell the diagnosis directly. You have to tell what is the X-ray, like what she is telling, like X-ray, plain X-ray chest and upper part of the abdomen in PA view. Next findings.
hard borders are not.
Skin and soft tissues, any abnormalities there, any surgical emphysema, any calcifications, you have to mention. Is it abnormal or normal? Skin and soft tissues.
Soft tissue abnormalities.
What, where?
No, not there.
This is the artifact. What I am showing, this is artifact, old X-ray. When taking the photograph, this is artifact. Don't consider this. So skin and soft tissue means here any abnormality, here you can see. Sometimes air will be there, subcutaneous emphysema, or maybe calcifications in the axillary region. Usually it denotes some lymphadenopathy, calcified lymphadenopathy, especially tuberculous lymphadenopathy. There may be calcifications, or sometimes cysticercosis, muscles also there will be cysticercosis, like in the brain, neurocysticercosis. Sometimes muscle also you can see the calcifications may be due to tuberculous lymphadenopathy or cysticercosis, calcified cysticercosis. So if there are clinically important, you will tell. Otherwise, skin and soft tissue is normal. Then bony rib case, you have to comment on bony rib case. Any bones here, neck is not clearly visible, but if clavicular fractures or rib fractures, scapular fractures, anything upper, but if humerus fractures, if they are able to see, we will mention. Then come to the cardiac borders, then lung parenchyma.
Yes.
Okay, ma'am, this
mention.
X-ray is not centered, right, ma'am? There is kinking of clavicle on the left side.
Okay. But what about trachea? Is it normal position? Here you are able to see the trachea.
Ma'am,
Is it
deviated slight to the right.
What about cardiac water? Is it normal? Usually this much heart will be there towards.
Ma'am, since the X-ray has not been taken in the centered view, so the cardiac borders can't be completely commented on, but the left cardiac border seems abnormal.
You are not able to delineate the left cardiac border. Cardiac border is this one. Actually, it's along with this, some haziness is also there. What is this findings? What is this? What is this? There is a horizontal line.
Fluid level.
Cardiophrenic and costophrenic angles are there, and there is a horizontal line. Okay, this is called as air fluid level. There is a horizontal line, and above that there is a increased translucency. Okay, are you able to see this? And intercostal space compared to the right side, there are widened. If you see intercostal spaces on the right side and left side, this side, left side, you can observe there is a slight widening of intercostal spaces and increased translucency on the left side, and there is a underlying collapsed lung. Actually, this is a collapsed lung. Okay, and there is a air fluid level. So most probably it's a X-ray of what? Diagnosis.
Pneumohemothorax.
Hydropneumothorax. Okay. Pyeopneumothorax also. We can't say whether it's a fluid is there, whether it's a hydro, that's a pleural effusion, or pus, or hemopneumothorax. Also, blood we don't know. So you can say it may be hydropneumothorax or pyeopneumothorax or hemopneumothorax also. Sometimes after trauma, but usually there will be underlying rib fractures will be there in case of hemopneumothorax. Okay. So cardiophrenic angle on left side is obliterated and costophrenic is also obliterated. Increased translucency above an area of opacity. And maybe hydropneumothorax, air as well as fluid is there. Horizontal line in the chest means usually air and fluid levels. This is the underlying collapsed lung actually. Heart is actually pushed towards the right side. This is the cardiac water. Actually, cardiac water will be like this normally. So left-sided hydropneumothorax or pyo. We have to differentiate after taking the diagnostic tap. Next, roll number 62. Roll number 62 present or absent? 65. 67. 70. Roll number 70. 75. 77. 77 is present or absent?
75 present.
70.
5 ma'am.
75. Can you read this X-ray?
Yes ma'am.
Just try to read.
Plain X-ray. Plain X-ray PA view.
Plain X-ray PA view of
Anterior.
posterior anterior view of chest and upper part of
Thorax
the
ma'am.
abdomen.
Posterior anterior view.
Posterior anterior view only. Okay.
Yes ma'am. Posterior anterior. Skin and subcutaneous tissue normal ma'am.
Okay.
Costophrenic angle obliterated.
Which side?
Right side ma'am.
Right side costophrenic angle is obliterated. Okay. What about cardiophrenic angle? Are you able to see cardiophrenic? Both are obliterated. Costophrenic, cardiophrenic,
yes,
and
cardiophrenic angle
are obliterated. What is this? Just now we discussed. What is this?
Air in
very clear horizontal line is there. Whenever there is a clear horizontal line in the chest X-ray, below is the haziness, above is the translucency. So,
yes.
What do you think?
So,
this is a clear-cut hair fluid level.
Hair fluid
there is
level.
a fluid below and hair above. Hair fluid
yes,
level is there. Horizontal hair fluid level indicates hydropneumothorax or pyeopneumothorax. Same previous X-ray. That is different person. This is different person. But other findings you should not forget. You can observe here. Where is this dome of the diaphragm? Almost down here. So there is hyperinflation, compensatory hyperinflation of the left lung. So hyperinflation, so increased translucency. This is not pneumothorax. You can observe these lung markings are prominent here, but translucency is there, and intercostal spaces are widened. Compensated hyperinflated left lung with right-sided hydropneumothorax. Okay.
Yes, ma'am.
Right-sided hydropneumothorax.
Right-sided hydropneumothorax.
That's a right-sided hydropneumothorax with clear hydropneumo or pyoneumo. We can't say.
Left-sided.
Next one. Right side. This is right side. This is right side. No, this is left. Okay, right-sided hydropneumo or pyoneumo with compensated left-sided
Hyperinflation. Left side.
hyperinflated. Here you can see up to this lung quills are there. Beyond that dome of the diaphragm also you are able to see the some translucence. Roll number 80. Present or absent?
Present, ma'am.
Can you read this chest X-ray?
It is a plain X-ray of the chest and the upper abdomen, ma'am.
Okay,
Taken
good.
in the PA view.
Not PA view. You are able to
AP
see
view.
spines, intervertebral spaces also. From down here up to even sacral region also you're able to see. Down also so much thoracic, lumbar and all those. So in the clearly if it is visible, spines and vertebral discs, it's always AP view. That too infants usually will take AP view in lying down position, supine position. Okay.
Yes, ma'am. Yes. Skin and subcutaneous tissue are normal, ma'am.
Okay.
Increased intercostal spaces, ma'am.
In which side?
Right side.
Okay. Intercostal spaces are widened. Anything?
Increased translucency on the right side, ma'am.
Okay. Good.
Collapsed lung on the right side.
Okay. What about this? Where is the heart? Heart is pushed towards left. Here is the heart.
Yes.
You can see up to this area is there. So even
Yes.
beyond the midline, here is here. What is this? This tube.
Intercostal tube.
Intercostal tube drainage usually will put it in a underwater seal. Okay, this is intercostal tube. Also, you are able to see. So, what is your diagnosis? Tell the shifted mediastinal shift also had grossly shifted mediastinum towards the left side.
Yes.
Okay. This is the collapsed lung board. This is collapsed lung with mediastinal towards the left side. So, what is your diagnosis?
Lung abscess.
Lung? It's a tension pneumothorax. Right-sided tension pneumothorax. Why you are calling it as tension pneumothorax means mediastinal, so much mediastinal shift is there. If you won't read this, if you won't drain, so the lung won't expand and mediastinal shift will be there. Finally, not only hypoxia, it will lead to cardiogenic shock also. So the heart cannot relax. So filling, diastolic filling will be decreased. So in turn, venous return will decrease and leading to cardiac failure also. Cardiogenic shock. So it's a very emergency, medical emergency. If intercostal tube drainage is available, you can put in the intercostal tube drainage to underwater seal. Otherwise, with needle also, white bore needle also have to usually we will do it in a mid-clavicular line, second or fourth space. In between mid-clavicular line, we'll just put a needle. It will release the air. Tension should be released. Otherwise, it leading to cardiac complication. Okay, that's what it's called as tension pneumothorax. Right-sided tension pneumothorax. Roll number 85. Is there or not? '85, '86. Anybody voluntarily can try this X-ray? Anybody from roll number 1 to your batch?
And normal X-ray, AP view.
Normal X-ray. First, you have to mention which part of the body it is, plain X-ray or contrast. Do you want to mean that's a plain X-ray? Abdomen or chest? Actually, it's not taken correctly. Only some part of the chest is visible, but sometimes X-rays will be like this also. You should read. This is the only one lower part of the chest and whole part of the abdomen. This is abdomen. You can see here is the femur. It's a newborn X-ray. Okay, newborn X-ray. So plain X-ray of lower part of the chest and abdomen. Just now you can read. Is it AP view or PA view?
AP view, ma'am.
AP view, because you are able to see clearly the vertebrae. What findings you are able to see? Yeah, actually, this is the feeding tube. Okay, this is the feeding tube, tip of the feeding tube. This is the feeding tube. Okay. Anybody voluntarily?
Skin soft tissues are normal.
Okay.
Haziness present at the right upper quadrant.
Right.
Homogeneous upper
This
quadrant.
is upper part of the chest and this all is abdomen. Pavan, I think. Pavan only, na? Pavan, nuvena matladedi?
Yes. Yes, ma'am.
So you can
Right
see
upper quadrant.
this is the liver. This haziness is there. This shadow. This what you are able to see the haziness is the liver. This is the spleen. Okay. That's why I told you this is the tip of the NG tube. That is here fundus something gastric. These are the intestinal bowels, loops of the intestinal loops. And you can see air under the diaphragm. This is the diaphragm here. So you're able to see
Hello, viscous perforation.
So it's pneumoperitoneum. This is totally pneumoperitoneum. In a newborn X-ray. So newborn supine here also mentioned. You can see supine means lying down position. Usually AP view you are able to clearly see the vertebrae. So air under the diaphragm in a newborn. Pneumoperitoneum we call as pneumoperitoneum. It's a complication of what? Fetum necrotizing enterocolitis. So necrotizing enterocolitis, advanced stages leads to pneumoperitoneum. The complication in case of premature baby with necrotizing enterocolitis. Okay. Roll number 100. Absent or present?
Present, ma'am.
Just read the X-ray.
Ma'am, it's a plain X-ray. PA view.
Plain X-ray of chest and abdomen, upper part of the abdomen.
It's in PA view, ma'am.
Okay.
Trachea is centrally positioned. Clavicles are equidistant. Borders of the heart are seen.
Okay. Cardiophrenic and costophrenic angles. Right side, some cardiophrenic angle is not that much clear, but it's not clear. But costophrenic angles on both side and the left side cardiophrenic angle is free. But
yes,
here is something. What is this?
Haziness.
Can you appreciate this? I'm showing with the arrow. These things. What is this? How to describe?
Hilar lymph nodes.
Hilar lymphadenopathy means homogeneous rounded margins. Homogeneous opacity will be there usually here and here also. Upper hilum and middle hilum. Here is lower zone. You can see. Are you able to see all of you? Haziness in between there is a small translucencies like cystic lesions. For example, it's looking like a honeycomb or not?
Yes,
honeycomb appearance. In which condition?
Pleural effusion.
Pleural effusion, it will be hazy, homogeneous like heart. Pleural effusion means it's like this, it will be. Is it like this? Non-homogeneous. Cystic lesions in the lower zone, right lower zone, honeycombing. Usually these children will present with early morning cough with copious amount of foul smelling sputum. What is that condition?
Bronchiectasis.
Good. So it's a case of bronchiectasis, right lower zone. So if you take CT, we won't put, but the completion check, I'm telling, this is the same person's CT chest. You can see here, this is the honeycomb appearance in the chest X-ray, also confirmation of bronchiectasis. Roll number 90. Roll number 90. Present or absent? 91. Roll number 91. 92. Anybody voluntarily? Anybody can try, any student. Divya is there? Chahat? Chahat, are you there? Absent. Sweta? Present or absent? Roll number 5.
Yes, ma'am.
Can you read this chest X-ray?
Yes, ma'am. It's a plain chest X-ray of the chest and upper part of the abdomen taken in PA view.
Are you sure? Is it
The
PA view or AP view?
ma'am, AP view. The chest is the X-ray is centered. Exposure is adequate.
Okay.
The trachea is midline.
Mm.
Costophrenic angles are clearly visible.
Mm.
The cardiophrenic angles are clearly visible, but heart seems to be dextro-rotated towards the right side.
Good. This is a dextro-rotated heart. Okay.
Yes, ma'am.
Is it
Skin and
isolated
soft tissues are
dextrocardia or situs inversus?
ma'am, dextrocardia, because liver shadow is clearly visible and abdominal bubbles are also visible, stomach
Okay.
bubbles.
Good. So among the isolated dextrocardia and situs inversus, which one is more complicated? In which condition there will be chances of complicated congenital complex heart diseases? Is it in
Ma'am,
isolated
dextrocardia.
dextrocardia?
Isolated dextrocardia, ma'am.
In case of isolated dextrocardia, there will be more chances of complicated congenital heart disease. That means more number, like VSD will be there, PDA will be there, TGA, truncus, like multiple malformation will be there in case of isolated dextrocardia than compared to situs inversus. So it's isolated dextrocardia. So isolated dextrocardia is often associated with complex congenital heart disease. Poor prognosis will be there. Roll number 130. 130. Present or absent? 130, 130, 135. It's a commonly given X-ray in the exams. Very, very common. If you won't answer, they won't pass you also. It's very fundamental X-ray. What I'm showing. 135. Anybody voluntarily? Just try once.
Plain X-ray.
Okay. Plain X-ray.
Plain X-ray of anterior posterior view.
Anterior posterior view of chest and upper part of the abdomen.
Chest and upper part of abdomen. Skin and soft tissues are normal. Costophrenic and cardiophrenic angles are clear. Right and left borders of the heart can be visible. And heart shape,
boot-shaped heart.
boot-shaped heart is present.
Why you think it's a boot shape? What are the features suggest you to say it's a boot shaped heart? Pavan.
Right side cardiac borders are extended, ma'am.
Right side.
Left side, ma'am.
Right side atrial enlargement is there. Okay, I will agree. Right side atria. This is atria. Usually it should be less than 2 spaces here. 1, 2, 3, 4, 400 spaces. So right atrial enlargement is there. But what are the features to you say it's right atrial enlargement with? What is the shape of the apex? This is apex of the heart. Upturned apex, right ventricular type of apex. Okay, it's upturned. Usually left ventricular apex will be like this. So it is the right ventricular apex.
And aortic arch is
And
distended.
there is a pulmonary bay. So pulmonary bay on the left border and upturned apex suggestive of right ventricular type of apex, and there is right atrial enlargement. So mostly suggestive of boot-shaped heart seen in case of
Tetralogy of
Fallot.
okay. So because of the pulmonary bay and tilted, uplifted or upturned apex we call as, and you can also observe there is pulmonary plethora, pulmonary oligemia. Plethora means more pulmonary bronchopulmonary vasculature. So here oligemic, you can say bronchovascular markings are very less than 1/3 of the heart. Usually, if you take consider into medial 1/3, middle 1/3, and lateral 1/3, usually normal bronchovascular markings will be up to 2/3. But if beyond peripheral 1/3, that is a plethora we call as congestion more in case of TGA, truncus, transposition of gate arteries. If it is less than 1/3, it usually suggests of oligemia. Here it's less than, here left side not at all visible, right side also less than 1/3. So there is a pulmonary oligemia is also there. Pulmonary bay is visible, upturned apex is there, and right ventricular type of apex and right atrial enlargement. Mostly suggestive of boot-shaped heart or core and subboot tetralogy of Fallot. Okay, is it clear? Anybody? Just read this X-ray, try. This is a class, not an exam. You can try. If you do mistakes, I will correct it.
Ma'am, this is a plain X-ray taken in a PA.
Name, I want your name.
Ma'am, Bharadwaj.
Bharadwaj, okay, good. Read.
This is a plain X-ray taken in a PA view showing
Good.
chest.
Okay, PA view.
Skin soft tissues are normal. There is adequate exposure. There is obscuration of left heart border margins. And costophrenic angles are normal on both the sides. On left side, it's slightly elevated.
Elevated. It's a left ventricular type of apex only. Elevated means it will be like this. Previous X-ray. Elevated means this is. Okay.
Okay. Right side, ma'am. Right.
Okay. What about bronchovascular markings? Just now I dealt.
Increased bronchovascular markings.
So increased bronchovascular markings, most probably it's a pulmonary plethora. Previous X-ray is a pulmonary oligemia. Here is pulmonary plethora. Actually, I shown this X-ray previous class also.
Yes, funnel-shaped heart.
Funnel shape. This is
egg-shaped heart.
Egg on end appearance.
Egg on end appearance.
Good. So narrow superior mediastinum. Mediastinum is here is narrow, and there is egg on end appearance. Seen in which condition? Which congenital heart disease?
Transposition of the great arteries.
Okay, good. Egg on end appearance. Plethoric lung fields, as we described, transposition of great arteries, that is TGA. Sometimes they call as transposition of great vessels. That is also same, transposition of great arteries and transposition of great vessels. What do you mean by that, Bharadwaj? Transposition of great arteries means what? Let Bharadwaj to answer. Bharadwaj, what do you mean by that? TGA. Transposition means? Okay, somebody trying to answer. Any?
Aorta on right side, no.
Be loud and clear.
Aorta on right side.
Aorta arises from right ventricle and pulmonary trunk from left ventricle. That is transposition. Aorta carries impure blood, that is deoxygenated blood, and pulmonary vessels carries pure blood, oxygenated blood. So anybody? This X-ray. Be quick. Only 20 minutes is there for me. I have to complete this because last week also I took X-rays and this week I will complete. We won't put all these X-rays. A few X-rays will be selected from this. So because we are regular batch, I'm telling each and every X-ray for your sake. But among these clear and important and common conditions will take and will give in your practical examination for orals. This is for completion check because you should gain your knowledge. You may be asked one of these X-rays in your PG entrance examination also, and it will be useful for your general medicine X-rays. Anybody voluntarily read this X-ray? Try to read. Okay, I will myself. I will describe. This is a plain X-ray chest and upper part of the abdomen. It's a PA view, well centered, not rotated. Skin and soft tissues are normal. No bony rib cage is normal. Here upper mediastinum is widened. You can see upper mediastinum is widened. There is pulmonary algemia plethora normal.
Plethora.
Pulmonary plethora. This is something looking like some any number. It's like any number. What is
8.
This number? Figure of 8 appearance or one man? Snowman.
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 Snowman appearance or figure of 8 appearance. Widened mediastinum due to atrial enlargement, both right and left atrial enlarged. So mediastinum is upper mediastinum is enlarged. And lung fields are plethoric. Seen in which condition? Figure of 8 or snowman appearance, PG entrance bit. TAPVC. What do you mean by TAPVC? Total anomalous pulmonary venous connection. Okay. This is the same X-ray and a different person, same condition. But depending upon the condition, sometimes you may clearly see. Here you can clearly see that there is a figure of 8 appearance or snowman appearance with pulmonary plethora. Same condition but different person's X-ray. This is also TAPVC. Can anybody read this X-ray? Try to read.
It's a plain X-ray.
Okay. Start.
Of anterior posterior view.
Okay, good.
With
showing chest and upper part of the abdomen. That also I have to mention which part.
Showing chest and upper part of the abdomen with right lung visible and costophrenic
heart border is here. Right side heart border is here. Left side heart border
not visible.
Almost yeah.
So costophrenic angle is not clear.
What do you think it is?
There is a fluid like on the left side of the heart. There is a
In case of pleural effusion, usually Ellis S curve will be there. Ellis S shape, usually upper part fluid won't go in, will be aeration will be there. It's most probably a case of cardiomegaly. If you take this, here also a clear angle. Usually in case of pleural effusion, costophrenic and cardiophrenic angles both will be obliterated. Here you can see small translucency. That means it's not obliterated. So
Yes,
like this shows haziness with not obliteration of costophrenic angle. We have to think about cardiomegaly. So cardiomegaly, we have to take the cardiac diameter and inner thoracic diameter. It is more than 50% indicates. In case of PAVU, in case of APV, more than 55%, it indicates cardiomegaly.
okay.
If maximum diameter of the convex T of the right side and left side we will take here, and this one we will add, and this will be the cardiac diameter, and from the inner border only we have thoracic diameter we have to calculate at the level of the dome of the diaphragm. This will be the transthoracic. So it is cardiomegaly. What are the conditions where we will see cardiomegaly? So when the cardiac diameter is more than 50% of the maximum internal diameter of the chest, we call as cardiomegaly. But in PAVU, we can take up to 55%. What are the conditions where we will see cardiomegaly? Congestive heart failure, myocarditis, congenital heart disease with increased flow like left to right shunts. TGA also we will see cardiomegaly, pericardial effusions, cardiomyopathy, dilated cardiomyopathies, and myocarditis. Okay. So how to differentiate means if this cardiophrenic and costophrenic both are obliterated, always think about pleural effusion. If their angle, costophrenic angle is free, think about cardiomegaly for your UG level. And diameter should be more than 50%. Here you can see almost more than almost 70%. Only this much lung only visible. Anybody this X-ray chest?
It's a plain X-ray chest of anteroposterior view with showing thorax and upper part of the abdomen. Right and the left borders of heart are clearly visible. With costophrenic angles not obliterated. And the apex of the right heart is hazy.
Right heart?
Right lung, sorry, right lung.
Upper zones, you can mention as upper, middle and lower zones, radiologically zones. If coming to the lung disease, we will talk about upper lobe, middle lobe and lower lobe. But radiologically, you can mention upper zones, middle zones and lower zones. So here, upper zones, there is a haziness in the right upper zone.
And the bronchial markings in the lower zone of the right lung are also not clearly visible. They are less visible.
Translucency is normal here?
No. It's
hypertranslucent compared to the left side. You can observe. So what is your diagnosis?
There may be air and fluid in the
air and fluid means there should be horizontal line. There should be horizontal line. That usually fluid will be above or below. Usually air will be above.
Fluid will be below actually.
In case of hydropneumothorax or pneumothorax, fluid will be down and there will be horizontal air fluid level. Above that line there will be hypertranslucency. That usually hydropneumothorax or pneumothorax, hemothorax. Here is a translucency in the above and lower zones is the haziness is above and translucency is below. So it's not a fluid air. Okay.
Yes, ma'am.
This is a compensated hyperinflation of the lower lobe of the right lung. So upper lobe there is a consolidation and there is a line. This is not horizontal. So that indicates a Collapse consolidation.
Collapse.
Sometimes foreign body aspiration, upper zones means aspiration is more common. There is a foreign body aspiration or a mucus plug and obstructing in the right side. There will be right upper zone collapse consolidation. So to compensate that, lower lobe will be hyperinflated. Sometimes total lung collapse on the right side means left side hyperinflation will be there.
Yes,
Okay.
Yes, ma'am.
Okay. Next, this X-ray.
It's a plain X-ray of anterior posterior view showing the thorax and the upper part of the abdomen. There is lungs are not clearly visible, ma'am. Both the lungs and cardiac margins are also not visible clearly, ma'am.
So how it is looking? Looking like what?
It's like total body
ground
is
glass appearance, called as ground glass appearance.
Yes.
Thorax, X-ray chest with ground glass appearance, but we are able to see some trachea and air bronchogram. Can you see this? This is a trachea, carina,
Yes,
division of right and main bronchus, and some. This is air bronchogram. We call as air bronchogram. So only you are able to see air bronchogram. So it's a case of homogeneous opacity in the lung fields, ground glass appearance, newborn X-ray, hyaline membrane disease due to surfactant deficiency. What are the risk factors? Premature baby. How will you prevent? Antenatal steroids to the mother. Treatment. How will you treat? How will you treat? No treatment for hyaline membrane disease?
Steroids.
That is prevention. Steroids is prevention. Antenatal steroids to the mother.
Surfactant.
Surfactant replacement. What is the mode of administration? Route of administration, how will you give? Is it IV, IM, subcutaneous, or some other route? Surfactant is given through which route? In case of hyaline membrane disease, endotracheally, we have to intubate the child, and through the ET tube, we will give surfactant with the help of feeding tube. We'll put a feeding tube into the endotracheal tube and we will give surfactant to the child. After that, sometimes maybe needs positive pressure ventilation for few hours or sometimes few days. And that's the treatment for hyaline membrane disease, because surfactant decreases the surface tension. So lungs will expand, alveoli will expand, and aeration will take place. So this X-ray, this is also commonly given in your orals in the case of general medicine and also pediatrics. It's very clearly taken X-ray. Findings are very clear.
Plain X-ray of lateral view of head showing the skull and the facial bones. The cranium is not smooth.
So cranium, there is convolutions, multiple convolutions over the cranium. Yes, otherwise called as silver beaten or copper beaten appearance. In which case, which condition it will be like this? Can you observe this? Like these convolutions we call as silver beaten or copper beaten appearance. It indicates what? Chronic raised intracranial tension. Any condition which is associated with the chronically raised intracranial tension will produce this type of convolutions over the skull. That's called a silver beaten or copper beaten appearance. It's seen in case it is associated with chronic raised intracranial tension. In case of pediatrics, it's a craniostenostosis. That means premature closure of sutures. So there is no chance to expand sutures. So there will be raised intracranial tension. This leads to convolutions. So silver beaten or copper beaten appearance, chronic, it indicates chronic raised intracranial tension, most probably due to craniostenostosis. Okay. Next, this X-ray you can't read. I myself will tell, or anybody try. There is no time. That's why I'm telling. This is X-ray, plain X-ray. It's not contrast X-ray. Plain X-ray of hand and wrist. Some part of the hand and wrist, showing 3 carpal bones. But what about the bones? There is no fractures. But what about this bones? Is it normal? Increased bone density. Increased bone density. It's looking like something like floor, marble bone appearance, marbles. Can you observe this difference? No trabeculations, very dense bones. Seen in case of marble bone disease, otherwise called as generalized increased density, radio density of all bones of the body. There is replacement of trabecular pattern with uniform radio opacity, chalk white appearance or marble appearance, and metaphysis appears clubbed. So it's seen in case of osteopetrosis. Okay, they present with anemia because bone marrow also will be replaced by this bone density. So decreased bone marrow and erythrocytes and all other series leading to pancytopenia, also initially anemia, later pancytopenia, otherwise called as marble bone disease. This easy X-ray, commonly kept X-ray. Can anybody will try to read? We can compare both. X-ray is very dense here. It's X-ray is extremes both. Osteopenic bones, very increased translucency of bones. So these are osteopenic bones with cupping, clear cupping and free. So cupping and free with osteopenic bones seen in case of
rickets.
Rickets. So can anybody comment on this X-ray? Wrist and hands and forearm. What is the shape of the metacarpals?
Rectangular shape, like box shaped.
Bullet shape.
Bullet shape.
Looking like bullets here. You can see. Bullet shaped metacarpals. And other features usually suggest to a What is the diagnosis? MPS. What do you mean by MPS? Mucopolysaccharidosis. Okay. Anterior beaking of vertebra will be. I will show you. So this is the anterior beaking of the vertebrae. Can you observe this? Anterior beaking of the vertebrae and lateral view of the chest for the spine, lateral view spine. You can see here vertebra or anterior beaking. Okay. So anterior beaking of vertebrae with the bullet-shaped metacarpals seen in one ribs also you can see. These ribs are called as oar-shaped ribs. Spatula shape or oar-shaped ribs indicates mucopolysaccharidosis. Here is the infantogram. Actually, if total baby infant is visible on the chest X-ray, we call it infantogram. Except for skull, all others almost like infantogram. So here you can see there is fracture here. Are you able to observe here? Fracture. Here also fracture. Here also clavicular fracture. Here fracture. And here also femur fracture is there. Multiple fractures with different ages. Healing with the different ages of healing. In infant. Mostly seen in case of osteogenesis imperfecta. It's a genetic syndrome where blue sclera is also visible with multiple, they're more prone fragile bones, so multiple fractures will be there. But whenever it is there, along with bruises, we have to suspect battered baby syndrome also, without any external injuries, with minimal trivial trauma. The baby is presenting with the fractures, we have to think of very fragile bones, osteogenesis imperfecta. So these are the changes we can observe in osteogenesis imperfecta. Generalized osteoporosis of the bony matrix, multiple fractures, especially of long bones and ribs. Fractures are radiological at different stages of healing with imperfect callus formation, suggestive of osteogenesis imperfecta. So here is the upper limb X-ray. this upper arm and forearm and hand. Are you able to see any abnormality? Usually in forearm, how many bones should be there? Ulna and radius should be there. Okay.
Yes, ma'am.
So radius here is absent, and also you can see only 4 metacarpals. So thumb is also absent. So this is a thrombocytopenia absent radius syndrome. Usually they will present with thrombocytopenia. It's congenital malformation. TAR syndrome. We call it TAR syndrome. So it's not X-ray. It's a CT film, plain CT, showing there is a ring enhancing lesion with perifocal edema. We call it perifocal edema on the right or left side? Left side.
Left side.
So most probably neurosarcosis or tuberculoma. There is associated MAN2 reaction is there. We think of it as tuberculoma with the history of contact. Without any history of contact, MAN2 negative. Sometimes we can see Scolex in the ring enhancing lesion that suggests of neurosarcosis. Okay. Same X-ray, same CT, plain CT. Sometimes they make you contrast enhancing CT. So any doubts? Any doubts are there? Then I will end the meeting. So X-rays are over. Immunization, I think off only over. I think some more vaccines they will cover in the next class. Okay, thank you. Shall I end? Any doubts are there for anybody? Any X-ray? Pavan and others.
Ma'am.
Doubts are there? Shall I close and end the meeting? Shall I leave?
Yes, ma'am.
Okay, bye.